Man, I'm telling you, a lot of our patients, they say, Doc, my feet hurt.
Yes,
It
they
hurts.
do.
So 75% of our patients are actually veterans or Army reservists. And with that comes a lot of foot problems because they got to be battle ready.
They are.
Right? They need their feet. They need to do training.
Most patients will complain, oh my gosh, I feel pain with my first steps in the morning. That plantar fascia is not well. It is like taking a rubber band and stretching it where you see the little tears in the rubber band because it's not well stretched. When it becomes a problem, it's time to see your podiatrist. We are here to help you one step at a time.
It's about you and me. Let's come together, positivity. Health is wealth, gotta take care of myself. Cause ain't nobody gonna make the change.
Hello, everyone. Welcome back to Health Talks by YWS. And look who I got at my side. We got Dr. Kordai Decoteau, our new clinical director and clinical director of podiatry and ancillary services. So guys, you know our patients got some foot issues. So we love you so much that we're going to fix that. So welcome, Dr. D.
Thank you so much. I'm Dr. Kordai Decoteau. As she gave me my accolades, I'm well known in social media at Talks with Dr. D and Sisters on the Vineyard. Talks with Dr. D is an umbrella organization for 3 pillars. Stepping Forward with Dr. D, which has been a show on black.org on the lower extremity that has featured all walks of life, talking about how to make you walk strong. The second pillar we have is Talks with Dr. D Breast Cancer, as I am a proud 6-year breast cancer survivor, and I have spoken from Divine 9 organizations, women organizations, the United Nations, to my own YouTube. And lastly, Sisters on the Vineyard, my nonprofit 501c3, which is a solstice for health, wellness, and financial literacy, occurring in this August 11th and 12th, on lovely Oak Bluffs, Martha's Vineyard. And I'm so glad to be a part of your wellness sources.
Welcome, welcome.
Thank you.
So let's talk about some feet.
Mm-hmm.
Man, I'm telling you, a lot of our patients, they say, Doc, my feet hurt.
Yes,
It
they
hurts.
do.
So let's talk about the most common conditions that I see here in the clinic. You know, 75% of our patients are actually veterans or Army reservists. And with that comes a lot of foot problems. So they often complain of plantar fasciitis, flat feet, pain in their calf muscles when they're running. I want to hear about all the different things that you can tell us about how to treat these conditions and how to make them battle ready. Because they got to be battle ready.
They are.
Right? They need their feet. They need to do training. And for our regular patients who are non-military, we do have a lot of issues. Sometimes they have toenail fungus. Sometimes they have just flat feet. It hurts a lot. Some of my medical providers, nurses, you know, the hospital floors are terrible.
And standing and running for your patients.
Yes. So a lot of them have foot problems.
Yes.
So let's talk about that.
Absolutely. So for our esteemed military and veterans, what do I see? Many complaints that we see, number 1 being heel pain. Number 2 being arch pain. Number 3 being my nails look gross, doc. Number 4 being I could have bunions. So let's break that all down. So heel pain usually happens when they have pain in the center of the foot or the side of the foot or all around their heel. A lot of times in the military, because of the repetitive motions of marching and running, we get an overpull of what's known as our plantar fascia, which looks like a band of celery. I like to use food. I'm a foodie. On the bottom of your foot that becomes inflamed with weight gain, strain, repetitive use. A lot of times we tell patients stretch before you do an activity, but also stretch after the activity. If you're an athlete, and definitely when you start approaching those 40s, 40 where, 40 who? 40s, because we're not as flexible as we used to be. And the plantar fascia takes a pounding that sometimes it can't handle. Most patients will complain, oh my gosh, I feel pain with my first steps in the morning. That plantar fascia is not well. A lot of your muscles have oxygen. That area doesn't have as much, and it becomes tight. It is like taking a rubber band and stretching it where you see the little tears in the rubber band because it's not well stretched. There's a variety of things that help with that. Morning stretches, something called a night splint to put tension on the foot during the night. When it becomes a problem, when you've tried stretching or even over-the-counter medications like Motrin, which is an anti-inflammatory, or Tylenol, it's time to see your podiatrist. Treatment can be anything from x-rays, which we always do to see what's going on bone-wise inside of your foot, ultrasounds to see what the ligament looks like, because an x-ray will show you bone mostly. And then we go from oral medications, injections, tapings, heel cups, which can go into your shoes, custom inserts, which I love because it helps put the foot in the proper position to encourage healthy walking. And when those things fail, then we have our surgical treatment. Minimally invasive, from radiofrequency to shockwave, which we do offer in our office, to traditional surgical procedures as well. So there's a multitude of things for heel pain. Number 2, my arch hurts. A lot of times the arch cannot be, you can have a flat foot, or you start collapsing flat foot. That can be from trauma and or weight gain, or flat foot that was never addressed when you were a kid, but now you're a lot heavier at this age. Again, with our military, the pounding, the walking that they're doing can aggravate the ligament, the posterior tibial tendon that inserts on a bone right in your arch. Treatments are similar for heel pain, making sure that we give you oral medication, injections, custom inserts, even bracing the patients, and when need be, shockwave. Some people have tried PRP and surgical intervention. Bunions, blame your mama. They are genetic. Shoes are an aggravating factor. Wearing tight shoes, wearing shoes that you are not comfortable, but genetics have a lot to do with it. For bunions, I tell people, there's a lot of the splints, those things. You can try injections to relieve the inflammation or fasciitis that occurs in the joint. Orthotics to prevent the progression of it and keeping that joint stable. And when those things fail, you're looking at surgical intervention. Now we have 3D, not 1D, 2D, 3D bunion surgery, which helps make the joint very stable to walk on. You have to be certified to do it. I am. And there's a lot of doctors who offer that when conservative options have failed. And then fungus. Just sometimes the shoes not fitting right, you get a repetitive hitting of our military in those shoes, which can allow bacteria and fungus to go under the nail. Your nails can turn dark. Your nails can become thickened, which doesn't always mean fungus, but doing a biopsy of the nail is really what guarantees an information of what type of infection you may or may not have of the nail. 3 options: topical medications for fungus. There's laser for fungus. You're like, ooh. Yes, there's laser for fungus. And lastly, oral medication. And all these options can be discussed with your podiatrist, like me, to tell you what options you have and what's the best option that you should choose for yourself. So there's lots of treatments. And then for our everyday person, our civilians, you see some of the same things with hammer toes, and the treatments are pretty much the same. It's about what works best for your lifestyle. And a good doctor is going to listen to your history, understand your medical background, understand what's going on in your lifestyle, what you can and can't do, and together come up with a plan best for you.
When you talk about the toenails being discolored, I had a flashback because I have several patients of mine who said they do not like the summer because they can't wear those wonderful male sandals, and even the females do, because of the toenails. And if they have to get it treated, they will remove the toenails, and they can't imagine themselves not having a toenail. So talk to me about what could be done if I have a toenail fungus that maybe it's black and thick and the nail needs to be removed in order for it to heal. What could be done that can help the aesthetics of it?
So a lot of times we have something called a rotary burr, where we'll smooth down and thin the nail out. With laser applications of how many lasers are determined by the type of laser you have and how extensive the infection is. One thing that's on the market is something called Keryflex, which is an FDA approved, instead of using those nasty acrylic nails, this is a FDA approved resin or kind of material that goes over to create a nail. I have done it many times when I practice in New York City. And so for people who are having laser, or if the nail was so far gone that it needs to be removed, once it's healed, we could put that over. And it looks like a pretty nail. You can paint over it. And my female patients loved it because they could be cute for the summer. Because I remember, God rest the dead, my favorite pastor, Dr. Calvin O. Butts III from Abyssinian Baptist, used to say, sandals is a privilege, not a right. And so with that, we used to make me laugh. And I would always tell people about what options you can do. I think the best time to treat nail fungus is during the winter because the nail cycle is usually 6 to 9 months. So by the time the summer comes, you are cute and ready to rock. But you know, it doesn't always work out like that. Life, as they say, life's or be lifing. So the Keryflex is a great option and that we do in the office. So those are all also things to be considered if you're on oral medication or laser. Topical medication is not something that Keryflex will work with because you can't get under there to apply as well. Yes. But if you're doing the latter two, that's always an option.
That's always a good option. Now, body image is a big thing with our patients, you know, and a lot of them, they want to be in the military. They want to do their work. They require, some of them has a physically active job and they have the boots that they have to wear. And sometimes they complain of fallen arches where they never had foot pain. They remember going in for their MEPS initially when they joined the military. And then over the years, as they do the rock marching and they do running and training, and they start pounding on the surface, they start having lots of pain in the arch and different things like that. And then all of a sudden, they go to a doctor and the doctor tells them that they got pace planners, flat feet. But when they look at their form, when they first joined the military, their MEPS form, they did not have flat feet.
Let's talk about that.
Talk to me about that.
So I hate the term. Pes planus is like a garbage dump term, okay? You have flat feet, but why do you have the flat feet? The posterior tibial tendon is a tendon that runs from your knee and inserts onto a bone in your arch. That tendon is almost like thinking of a bridge. It supports the bridge, or the hard part of the bridge is your bones. If the tendon does not have a good bridge to be supported, or if you have, you know, the cables that you have, you see that the bridge can be floppy woppy, right?
Yes.
And then those things can rip, as you've seen.
Yes.
The tendon is the same thing. So it needs a stable construct, which means that this joint has to be in a good position. Wear and tear, osteoarthritis can happen, which is wear and tear from, or traumatic arthritis, injuries that may occur. And that joint can become sometimes unstable. And therefore, the tendon that inserts on it becomes inflamed. Yes. And they say, I have flat feet. It may not be that it's flat. It may be that you had a flat foot previously, or that the tendon is just so inflamed, it may appear that it's flat. If it tears, it can become a flat foot because now there's nothing, it's torn, it's nothing there holding it. There's 4 stages. You can do, it may be from the beginning stages where, hey, you know what? This patient may need some physical therapy. And an insert, a custom insert, not that over-the-counter stuff, but where we take a mold of your foot, either through 3D, which some computers do, or through foam, or even casting of the foot, where we put the foot in a position where it should be versus where it is, and that orthotic or insert is created, and they can go into your boots, which helps a lot of people. If it doesn't, you can pair it with physical therapy, oral medications, injections. Yeah. If those things are failing and an x-ray has been done, then the next step is an MRI. The MRI is going to give us a picture of everything, the tendon, the bone, the ligament, everything, to see what damage is there and what can be done. Sometimes if it's that far gone, surgical intervention, which can be anything from fixing the tendon or fusing the joint because the joint has become unstable.
Wow. It's amazing. So many things you all do as podiatrists.
We do,
you know, and it's a wonderful thing that you can break it down and really help us to understand why the treatment is focused on certain areas of that condition. So talk to me, when you think of our community, we are in the DC, Virginia area. What are some of the things you would like to see at YWS? You would like to do more of, or you would like to really engage patients in doing in terms of foot health?
So April is Foot Health Month, which is ironic. I love to see people wearing proper shoes. Now, I'm a fashionista. I will admit that. Don't judge me. But I also know there's a time and a place. New York City, where I did my training, and living in Jersey, and even the DMV area, what do? Run for the bus, run for the car. And sometimes for those of us who drive, we have that option of sitting. I tell people who take public transportation, you can be as cute as you want to be. If you're a woman and you wear heels, wear sneakers until you get to work. Wear a comfortable shoe. Wear a shoe if you wear flats that have your custom orthotic or insert in it. Men, if you're wearing hard bottom shoes or even soft bottom shoes, consider a custom orthotic or a sneaker. If you have to change into a shoe that's a lot more fashionable that may not accommodate those things, then do that at work, because many times if you're corporate, you're sitting. If you work a job standing, our post office folks, school crossing guards, nurses, doctors. In the medical world, I love a clog. Not that over the counter you can bend in half, but the traditional dance-flow clogs that we wore in our residency surgery. You see the surgeons wearing them. Love it. I could backflip in them coming off of a call because they supported my arch so well. Yes. That was a great option. But also, again, a custom orthotic is what is the way to go for walking so much and doing so many things. Heels, I know I'm going to get women looking at me crazy. I love a good heel, but standing in a 3 or 4 inch heel that's what makes you look your butt poke out because you're being thrown forward. And you're putting a lot of pressure on the forefoot, which is why a lot of women will complain of shooting pain, which can be nerve pain known as a neuroma, pain under the ball of their foot, which can be metatarsalgia, and those types of things that cause discomfort. Men may experience it in some of the hard bottom shoes as well because there's no cushion. There's no, for them where they're feeling a constant pressure in the ball of their foot or even their heel. So I say, as much as you can, use those shoes for when you have to make sure you have the right shoe because you need to.
Wow, this is beautiful. I have to definitely invite you here again.
Thank you.
Because this is really some nice tips for us to think about our family members or loved ones, our soldiers, making sure they're battle ready and making sure that we love on our feet. It's very important, guys, that we love on our feet. Thank you so much for joining us at Health Talks by YWS. And I thank Dr. Decoteau for joining us today.
Thank you so much for having me. I look forward to treating you at your wellness sources. We are here to help you one step at a time.
Come on, work it out. What? Come on, work it out. Come on and work it out. See, health is wealth. Come on and work it out. You at the gym right now. Come on and work it out. See, health is wealth. Come on and work it out. Yeah. Come on. It's about you and me. Let's come together, positivity. It's about me. Health is wealth, gotta take care of myself. Cause ain't nobody gonna make the change but me. So let me put in the work.